Welcome, everyone, to the day 4, I believe, of the Trade with Africa Business Summit, the 4th edition. I want to welcome everyone. I know a few more people will be joining us, but we really do want to respect time and get right to it. And today, our first speaker is Dr. Adeni Oshamili joining us. And I just want to share a little bit about him, a short bio. He's going to be talking about healthcare in Africa. Okay, Dr. Adeni is the founder and CEO of Premier Medical Systems, a digital health company with focus on leveraging information technology to improve access to quality and affordable care in Africa. PMS, which is Premier Medical Systems, specializes in the design, development, deployment, and support of solutions in healthcare sector. PMS also owns DocuLink, which is Africa's largest online physician network. DocuLink helps consumers easily find and book appointments with specialists. DocuLink is a leader in facilitating and advancing the education and learning of healthcare professionals on the continent. Dr. Nee is also currently the chairman of the Medical and Pharmaceutical Group of the Lagos Chamber of Commerce, which is the oldest Chamber of Commerce in West Africa, I believe. Okay, the second oldest Chamber of Commerce in Africa and the oldest in West Africa. So please welcome to the stage, Dr. Nee Oshamili. Dr. Nee, you have the
Thank you
floor.
so much, Tony. Hello, can you hear me? All
Yes,
right.
sir.
Thank you thank you so much, Tony. I'm grateful for you having me on this platform. We were together last year, and thank you also for having me this year. So when I'm just going to be speaking generally, sharing my thoughts about health in Africa, building on some of the conversations that we had last year, and trying to stimulate our thoughts around healthcare in Africa. So when we had this conference last year, was just a couple of months into COVID. COVID has just started, at least in Africa, just about 4 months into COVID. And we talked about what the landscape was like before COVID. The things I want to highlight right now, I want to try to highlight what are the things that that we have learned from COVID. How has COVID impacted healthcare generally? I think the first thing is previously, pre-COVID, healthcare practitioners, healthcare leaders, leaders of healthcare in government, they had a difficult time justifying the importance of health. But with COVID, everybody in the world right now, at least above adults in the world, they understand the importance of healthcare in relation to other things, in relation to the economy, socioeconomic factors, etc. They understand the importance of healthcare. And without healthcare, well, probably healthcare can wreck economies, can take away things, livelihoods, etc. So that's the first thing. We now fully understand the importance of healthcare vis-a-vis socioeconomic factors. Second thing I think regarding COVID was that without a doubt, COVID exposed weaknesses in healthcare across the world, but more especially in Africa, where of course Africa is with the burden of disease in Africa, and the lack of healthcare workers, healthcare professionals in Africa showed the lack of infrastructure, beyond showing the lack of infrastructure, equipment, even professionals. These weaknesses were exposed by COVID. But one good thing, again, by COVID, you may describe it as a good thing. My work is around technology. I'm a medical doctor, but in the last 11, 12 years, all my work has been around technology. And COVID, I don't know if we can say, I don't know if COVID in any way can be described as a blessing. I don't think so. But in terms of technology in healthcare, digital health, COVID supported the acceleration of adoption of technology. First of all, in the delivery of healthcare services. So we saw, first of all, more companies, more startups springing up, and as more telemedicine startups coming up. But beyond telemedicine startups coming up, we saw even healthcare facilities, government facilities, private facilities adopting telemedicine. So it was not just startups coming up with fancy ideas around telemedicine and people adopting it more. It was also hospitals, healthcare facilities, even public hospitals, which you will normally assume to be slow in adopting technology. So a lot of that happening with the COVID era. But beyond that, one other critical area where we saw acceleration and adoption of technology in the healthcare space was in the education of healthcare professionals. This is somewhere where we are very passionate about, where we work a lot. So previously, delivering education and delivering knowledge to healthcare professionals, not networks, online networks, was really, really a difficult thing when you talked about within the healthcare community. But with COVID, we saw a greater adoption of that. Another thing that we saw with COVID was partnerships. And I think partnerships was really key across Africa. We saw governments partnering with NGOs. We saw greater partnerships with private sectors also partnering with government, etc. But again, a partnership which I think we didn't do a lot about in Africa, and which I hope going forward we will do more about, is in the private sector. I want to see more of the private sector. When I say private sector, I mean banks, telecom companies partnering with the private health sector. So that's not something that is really common. I want to see a situation where you have banks, pharma partnering with pharmaceutical companies, partnering with hospitals, etc. That's something that I think more of it should happen in Africa. Now, there's something critical that I think we need to learn in Africa. We need to learn that I think with the advent of, so we had COVID coming, after COVID, then we had vaccines. There's a genuine fear that I have with vaccines. HIV, we know where HIV was first discovered in the world, but we now see HIV more as a disease of developing countries. I have a genuine fear. We know, again, where COVID came, where in terms of the history, where COVID started, in terms of the epidemiology of COVID. I have a genuine fear that I hope COVID will not become a disease of the developing world. And I think that's something that African leaders, presidents should awaken to. We've seen nationalism around the distribution of vaccines. Some countries, in terms of the number of people that have been vaccinated, we've seen how many Africans, we've seen the work of WHO and COVAX facility in trying to increase vaccines, Africans' access to vaccines. And we see where we are right now. So I think African leaders, they need to see how once COVID become a disease of the developing world. That's something that is really, really important. Again, I think this also presents an opportunity. I think it presents an opportunity whereby we talk about the African continental free trade zone. The African continental free trade zone allows Africans. It provides a ready market for things. So my question is, how come African leaders be able to develop vaccines locally? Why can't we develop vaccines locally in Africa, rather than being dependent on external world When I mean external world, the developed countries, Europe and America, etc. And I think this has to be a challenge to our leaders. With the African Free Trade Continental Trade, it gives an opportunity for pharma, so Africa as a whole to become a market, and it makes a business case. There's a business case for developing vaccines, actually producing vaccines in Africa. The other thing I want to share about is around digital health in Africa. This year we've seen two African unicorns in fintech. We've seen Flutterwave and we've seen Cheaper Cash become unicorns. That means the valuation being worth over $1 billion. But unfortunately, in healthcare, digital health, there has been relatively slower adoption. I've always asked myself, because this is a space where I operate, why is adoption slow in digital health? When are we going to have the African digital health unicorn? I don't know how many years we have from that. When you compare fintech and digital health, fintech, they are both regulated spaces. So healthcare is regulated, fintech is also regulated. But why is there so much adoption, acceleration, growth in an attraction of capital investment in fintech, and you don't see similar in digital health? Definitely, it's not regulation. But again, I think part of the reasons why this may be is around the complexities around healthcare. Healthcare, I think it's just a complex space. And I think, again, there are a lot of things that need to be in place, which will happen with time for that space to flourish. A few years ago, we talked about mobile technology being the next thing, being the greatest thing, and now we're talking about artificial intelligence. I'm hopeful that we will learn in terms of the types of pilots that we did for mobile technology, and to see what we can learn when in the adoption of artificial intelligence. My final words is around how healthcare is seen around, especially in relation to technology, how it's seen across Africa. I think one of the things is that a lot of development partners, and so there is funds, there's capital, but Africa is oftentimes seen as a laboratory when it comes to healthcare, where you do pilots, where you do tests, you bring capital, you do tests, then you come up with reports and you present those reports in Europe and America. I think that has got to change. I think there's got to be, with this capital, some of this capital has to go into partnerships with the private sector, so that we can talk about scalability and we can talk about sustainability. We should move away from Africa being a laboratory. That is something that I think is critical, especially when it comes to healthcare and when it comes to digital health. Thank you, Tony, again for allowing me to be on this platform this year. I hope I've been able to add some thoughts, and I wish you the very, very best this year and on to the next. Thank you. Over.
Thank you so much. And there are already questions. So if you still give us some more time of your precious time, there's a question right here. I'll just read it out, Dr. Nee. It says from Abosede. It says, how can telemedicine or digital health help patients with sickle cell disease? We know that Nigeria has the highest birth prevalence of sickle cell disease in the world. Any thoughts, sir?
All right. Thank you so much, Tony. It's interesting that I actually left a meeting. I think that there's a celebration of World Sickle Cell Day. I know there's an ongoing meeting right now that I just left that is being spearheaded by the Sickle Cell Foundation of Nigeria, that I left to attend this meeting. So first of all, telemedicine is key, is important in terms of healthcare delivery. So whichever ailment, whether it's sickle cell, whether it's any chronic, whether it's a chronic disease, telemedicine is important. And I think it's vital. It's become more vital because of in COVID, because of physical distancing and the public health measures that have been adopted. So Abosede, yes, telemedicine, in terms of talking about digital health, it can play a role in managing sickle cell disease patients, and indeed any chronic disease, because again, chronic disorders involve regular or frequent visits to the hospital, refill of medicines, drugs, and things like that. And so when you can save cost by not having to make that journey every time, telemedicine definitely has a role. Thank you. Over.
Yes. So a question from me is, what's the role of the diaspora? We have a lot of, health professionals, African health professionals outside, living and working outside of Africa. And some of them do wish to stay connected in one way or the other. What would be your message to them?
Uh, so like you rightly said, um, Nigeria, for example, um, has a rich diaspora. How can I put that? Diaspora practitioners, if that is appropriate, across the world, whether it's in America, whether it's in South Africa, whether it's in the UK. Indeed, there is MANSAG, Medical Association of Nigerians across Great Britain, and there's AMPA, Association of Nigerians in practicing in North America. One critical way, and I think that is happening. For example, I was part of a meeting in April where MANSAG, in terms of capacity building, typically before MANSAG and ANPA they will typically come down to Nigeria on missions. But of course, because of COVID, that has not been able to happen. But again, because there's the opportunity for virtual meetings, and I'm aware, and I've indeed been part of supporting and facilitating such meetings. The most recent was in April, where Nigerian doctors, practitioners in Britain tried to deliver training and knowledge to Nigerian doctors based or living in Nigeria, who are members, of course, of the Nigerian Medical Association. So again, diaspora doctors or diaspora healthcare practitioners or healthcare professionals have a role. But beyond facilitating training, you have Nigerians actually returning. And I think that is across Africa. I give Nigeria only as an example. You have people returning from the UK to set up cancer centers, oncology centers in their countries. So first of all, they are coming, they are attracting investment, setting up centers. But beyond coming to set up centers, some of them come from time to time. There's a doctor in the US, is a neurosurgeon. He comes from time to time to perform procedures in Nigeria. So they're bringing their competence, their capability, their capacity, they're bringing it to Nigeria. They're also attracting investment. So those are a couple of ways that the diaspora keep on contributing to supporting healthcare in Africa. Thank you. Over.
Fantastic. There's also a question from Mukwanka Shivpande. I apologize if I said that name not so correctly. The question is, can digital health help or facilitate youth suffering from mental health who are afraid to seek help, and how would it be applied?
Yeah, so thank you so much for that question. So again, digital health is awesome. Digital health is fantastic. But I would say this, so generally speaking, before I try to address that question, at times we have to be careful with digital health so that we don't have a solution looking for a problem. So you have a solution, you have a nice technology, you have AI, or you have something, and you're looking for the problem to use that solution to, to apply that solution to. I found that most of the time in healthcare, technology is better as an enabler. It could be something that was happening physically before, and because of technology, you are now able to take it remotely, digital health. Without a doubt, I see the role of technology in digital health, because of course, I see the role of digital health or technology in mental health, because as you will know, because of the stigma and etc attached with such conditions, some people may feel uncomfortable seeking help in terms of going to the hospital, or even in terms of follow-up. So technology may be able to bridge that gap. Technology may be able to provide anonymity. Technology may be able to provide privacy. I think those are ways that technology. So you have a problem of anonymity, you have a problem of privacy, etc. Yes, technology can be brought in to try to see how it can solve that. So I think that's a very important way to think in terms of introducing technology. If there's a problem, let's try and see if we can use technology, not having a fancy technology, then trying to look for the problem. Thank you. Over.
Yes, and you have some fans here. Miss Abosede, who says she would like to connect somehow. So definitely, that's something. If you're open to, definitely, I know. Usually when we're in person, there's more interaction there. But I want you, sir, to help us dive deeper into your role as the chairman of the medical and pharmaceutical group of the Lagos Chamber of Commerce and Industry. Like, what does that role entail, and how is the private sector really organizing itself within the medical space right now? Just if you could just shed more light and reveal more of that to us.
Okay, all right. So there's Niyi, first of all, Niyi, the business person owning a company, trying to drive prosperity for the company, drive prosperity and growth for the company. Then there's Niyi, now because of my work in primary medical systems, now holding a position at the Lagos Chamber of Commerce. Lagos Chamber of Commerce has a number of groups, different groups or different sectors, as we like to call it, oil and gas, telecommunications, etc. Sectors or groups. So we have the medical and pharmaceutical group. So I currently chair that group. LCCI essentially is about advocacy, advocating in terms of regulations, advocating in terms of trying to remove the stumbling blocks, the roadblocks, trying to see how we can improve the general environment of business. Everybody that's been in business will know, you have to engage in terms of taxation, etc., regulations, etc. So pretty much we try to engage with government, see what regulations, issues our members have, and see if they have challenges with regulations, whether it's with taxation, etc., and see how we can advance those and probably solve issues of our members. I hope that
Yes.
answers your question too.
Yes, definitely. Thank you. I also want to dive a little bit into COVID, right? In terms of just sharing a little bit more practical in terms of how the government and the private sector worked hand in hand. And even when it comes to maybe, for example, vaccine distribution, what role did maybe the chamber play? Did you have a seat at the table in terms of when government was making such decision? Was the government leading? Was the private sector leading? Because definitely it's a highly regulated space. But how were those decisions made in terms of who got what vaccine, and which facility were enabled or supported by the government? Like, just any information you feel comfortable sharing with us.
Okay, just two key things. So generally about COVID, private sector was heavily involved in supporting governments, and it was again it was really key for private sector to be seen to support government at such a time where all hands had to be on deck. The private sector was involved in building health facilities, and I think that would probably be the same across Africa in terms of private sectors trying to build isolation centers, and that wasn't different in Nigeria. Private sector setting up health facilities, isolation centers, trying to drill down in terms of vaccine distribution. As a chamber, part of our work was trying to, on one side, advocate even to our members and to the community in terms of vaccine hesitancy. But you will know, like all across the world, at least most of the countries of the world, the actual procurement of vaccines is being led by governments, and I think it's not so different across the world. Vaccine procurement is being led by government, and again, it's how challenging government again has to reach out to COVAX, which is under the partnership with WHO, to even be able to get vaccines. And indeed, in Nigeria, the private sector is restricted from, because government talks about counterfeits and things like that. So government leads procurement. The private sector is involved in supply chain logistics, in actually distributing those vaccines when they arrive. So that's the role of the private sector, supporting government in terms of distribution, and advocating in terms of trying to see how we can reduce the vaccine hesitancy, even amongst healthcare professionals and even amongst the public. I hope that
Wow.
helps too.
Yes, yes. Wow, definitely. One thing you also shed light on last year, um, in terms of, people seeking health outside of Africa, and with border closure, having to look within the continent for services. Has anything shifted, or has that gotten better in terms of visibility, in terms of where specialists are? Because I know that's also part of the work you do within the consumer market, in terms of you having shared with us in the past that one of the reasons you believe people seek care abroad is because in the first place, they don't even know where those specialists are on the continent. So what has anything changed since the last time on that?
Yeah, so I think again, if you, like I said, I don't know if we can say COVID, can describe COVID as a good thing in any way, but we can, if in discussing the impact, the impact of COVID, I think one of the ways COVID has impacted across Africa, in terms of the health seeking behavior, how Africans access healthcare. I think it has made them look inward. Even before the crisis, the COVID crisis in India currently, a lot of Nigerians now started looking inward. How can we access care? Because in terms medical tourism is a huge issue in Nigeria and other African countries, where you have Africans seeking care outside outside the country and outside the continent. But again, because of lockdowns and restrictions in travel, etc., Africans had to look inwards. They had to, and that has led to greater visibility, especially for specialists. A lot of them are doing better in terms of. So I say this in terms of a lot of specialists that care that warrant people weren't seeking locally. So people are now accessing those cares. Again, there are still challenges, challenges in terms of accessing some equipment. But again, we see progress in terms of reversing medical tourism, and Nigerians and Africans accessing care and greater visibility for specialists in country. Thank you.
Okay.
Over.
Yeah. So the last question for me, if we don't have any from anyone else, would be just getting some predictions from you. Within the context of the African Continental Free Trade Agreement, I see there's a gap right now, and just predicting who is going to fill that gap in terms of which country is going to lead, which country is going to be the leader in terms of maybe manufacturing of health equipment or injections and all of those things.
Yeah.
Which because there's really no big player. I know Zimbabwe tries to talk about, healthcare, tourism, being a hub. because a lot of people fly there for else, right? What are your predictions over maybe the next 5 years in terms of which country would emerge as a destination for premium health on the continent?
So Tony, thank you for the work that you're doing. You have to keep doing this work. So
Wow.
you will imagine we wouldn't essentially when I use the word we, I mean Africa and Africans, we wouldn't find ourselves where we are right now with Ebola, with Lassa fever, and etc. With all these epidemics, etc. that have occurred in the past. So the opportunity, the reasons, the justifications to invest in healthcare has always been there. The weaknesses have always been there. COVID has exposed it further. Uh, we see what's happening with the vaccines. So again, we ask ourselves, this opportunity is not new. The Africa Free Trade Continental Trade the agreement further, if you like, broadens, expands this opportunity. So the opportunity has always been there. It's not a new opportunity. But we ask ourselves, is government going to support people to take advantage of this opportunity? I think the private sector will try to lead in this, and I think that is what is essential. The environment has to be created, which AFCTA has essentially done. We will essentially see how this goes. As much as the private sector can do within the limitations, within the restrictions, that will keep going. But again, you will know there are a number of things that you will normally expect government to drive. Having a WHO accredited pharmaceutical manufacturing company involves a lot of politics. Those things will require support, advocacy from government supporting the private sector. So that much I will say for now. But again, you have to continue doing this. Your great work. Let's keep seeing how we can see how we can improve the position of Africa in terms of healthcare across the world.
Yeah, yes, there are more questions coming in. Maybe we can take two more and then I'll combine. There were two that came in, but I'll combine them more along the lines of what should be prioritized when it comes to investment right now. Should it be vaccines or something else in the health space, or like you say, telemedicine, or is it digital health? Like, what should be maybe the top one, two items that people need to really laser focus on? And then I believe there's one question from one of our panelists, and then we'll wrap up this section. Please. Thank you.
Okay, so we look at the population of Africa, where we are now and where we will be in the next 5-10 years. When you look at the population of Africa vis-a-vis the population of the world, I think something that will always be relevant, that will always be important, that will always be required for investment is drugs and investment in vaccines. A lot of drugs in Africa, of course, is invested in is manufactured outside the continent, Asia, etc. So I don't think anyone will get it wrong, and I think in a way it's a relatively low hanging fruit, relatively, and I say that carefully. It's a relatively low hanging fruit in terms of manufacturing drugs. There are other things, investing in technology. So when I mean technology, I mean devices. But again, that might be another step. But I think one of the things that we should start thinking about is how can we invest in consuming or producing the drugs that we use. That is an unbelievable opportunity. Technology, yes, technology will always be relevant, and I mentioned that in my presentation. Fundamentals, probably in a few years' time. So if you're looking for a kill right now, it's probably not there in terms of digital health. So if you're willing to wait for the long term, the fundamentals to be there, maybe you're willing to either throw some money at fixing the fundamentals, or either money or time, or just wait for those fundamentals to be there. And so I talk about scalable, and I talk about really on the scale of companies that have emerged like Flutterwave and Chipper Catch. I don't know when digital health will get to that scale. But again, now is maybe a time to start and to begin to wait it out. We started in digital health. We've been here in this space for quite a while, maybe 8, 9 years. So maybe in a couple of years, will be described as an overnight success. If you can describe 15 years as overnight success, but we've been in digital health for a while in Africa. We've been learning and learning and learning. So it's when I say digital health in Africa, you can try and throw cash to it, like Jumia has done to e-commerce, and it has not really worked. You know, again, it depends on how much cash you have to throw at it. You can become a unicorn, but again, when you look at their revenues vis-a-vis what they've invested, or you can be there, be prepared, and see how things evolve if you don't have all that cash to throw. I hope that
Yeah.
provides some additional clarity. Thank you,
Yes,
Tony.
yes, yes. And you talked about your nine plus years. Could you, and Mr. Desati, do you still have a question? Could you really just share maybe one or two lessons learned, particularly the Omowumi digital health solution that you implemented? Because a lot of times, like you said, people say overnight success, but what have you played around with? What did you learn from delivering at the maternal health level, in particular your company delivered, and what did you learn from it, and what do you see as the future in that space? I know I'm just
Uh,
bottling. Yeah.
yeah. So what I'll pretty much say I've learned. Um, so in healthcare, again, I have highlighted some of these. Healthcare um, is a very, very interesting space, complex also. Part of the, but critically, what I would like to say, considering this platform, is that there has to be greater partnerships in healthcare. Healthcare is really, really tricky because, again, you have to look at, are you trying to serve consumers directly? What's your business model? Are you trying to serve governments, consumers through government, meaning maybe the government owns the patients through public health facilities and public facilities, etc. So delivering digital health solutions in Africa and I believe across the world, especially where there's no insurance coverage. And I think that's one major thing that has slowed down adoption of digital health solutions because normally you would need, if you like to say, off-takers of solutions. So if you come up with a solution and you want to sell to consumers will have to pay out of pocket. It's difficult. In Nigeria, for example, health insurance coverage has been 5 to 10% of the whole Nigerian population. So you see a market of 200 million people, 200 million Nigerians. But in actual fact, in healthcare, that market is not there. It's not there because a lot of people still have to pay out of pocket to access healthcare normally. So if you have a nice digital health solution, the people that you should normally approach are the people that have aggregated patients, which normally should be health insurance companies. But that is that is probably almost non-existent in Nigeria. You have health insurance companies that, and I can't blame them, they're very, very profit driven. And you can't really blame them because they have to survive. So survival is the first thing. And when survival is the first thing, innovation is not the first thing, is not on the agenda. You're trying to survive. So how do you want to innovate? How do you want to adopt solutions and things like that? So that's something that is common in Nigeria, in Africa, where there's no universal health coverage. Then it's difficult for digital health solutions to scale because consumers are already, there's competition for funds and things like that. So that I think is one critical key insight. Universal health coverage. So if you're in the NHS, for example, in the UK, if you have a solution and you're able to sell to the NHS, then that scales almost immediately. So those are. Then again, most of capital to support digital solutions, you will find most of those capital grants going into pilots. So that is something that happens frequently in Africa. You could have pilot. So I see different things in Africa, and I laugh. this money coming from funds coming from development partners, you see NGOs duplicating the same thing, even in digital health, they're doing the same thing, and there's no consideration for scalability, sustainability. It's just maybe we've got access to this cash and we will burn this cash. And then it goes like that. And that happens frequently across Africa. It's difficult to understand. This money is from USAID. This money is from Bill and Melinda Gates. It comes to NGOs, support digital health projects. They're doing almost the same similar things. Or this one, and that money in 2 years' time is practically boom like that. So I think fundamentally some of these NGO funds should, let's see how, if some of these funds, I know it's their money, but can it support fundamental things? Can it go into building structures, fundamental and critical things that will add, I think, greater value to the ecosystem, rather than done just, if I may use the word, transactional things, and 1 year down the line, it's just maybe a record of, we spend this money and you're open. So they have this project. So this is the model that usually happens. A development partner gives money to maybe an
waiting. We were all stimulated. Please, Dr. Nee, go on, please.
To be honest, I don't know where I stopped. But again, I don't think I mentioned internet issues as part of the problems of digital health in Nigeria. Maybe that was why that happened, and I had to add so that I could quickly say this. So, so that's pretty much. I think development partners, NGOs should try and learn from how they've committed resources or deployed their resources in the past, and probably consider greater partnerships with the private sector, because private sector typically thinks scalability and sustainability. Those are two things that are important to the private sector in deploying resources: scalability, sustainability. Then you can also talk about profits. But again, these are conversations that can be had. I think it's critical. Development partner and private sector, NGOs, they need to come together in healthcare. Digital health, critical, very important. Thank you, Tony.
Wow. Thank you so much. And thank you for dropping your email as well. And if you could also drop your Premier Medical website, anyone that wants to access, if you're open, and I know you're always, thank you so much. And such an honor. Everybody help me to thank Dr. Nee. I mean, if we were in the hall now, we'll be able to clap. We'll be able to clap for you. Thank you, sir. Such an honor. Thank you. Yes.